Hi, everybody. I'm here with Dr. Werlin, and this is your host today, Dr. Nam Lee from Lee Acupuncture. Hi, Doc.
Hi, how are you?
Good. How are you? Thank you for
Good.
being here.
My pleasure.
All right. So let me introduce Dr. Werlin briefly about his credential. So practicing in Orange County since 1982, Dr. Lawrence Werlin is a nationally noted specialist in reproductive endocrinology and infertility. Is the founder, excuse me, and the medical director of Coastal Fertility Medical Center in Irvine, California. Dr. Werlin was the founder and director of the Hoag Memorial Hospital Fertility Services. He serves as a professor in the Division of REI at the University of California, Irvine, and where he has been a member of the clinical faculty since 1982. His credential as a leader in reproductive endocrinology and infertility earned Dr. Werlin the respect of his peers and patients. Dr. Werlin pioneered the use of pre-implantation genetic diagnosis, PGD, in Southern California, and is considered a nationally noted expert in its application. He was the principal investigator of the 3 major PGD studies that are forging the way for the future of reproductive medicine. Among his many accomplishments, Dr. Werlin was honored as the recipient of the National Fellowship in Reproductive Medicine at the National Institute of Health. He also serves as a chairman of the Validation Committee for the Society for Assisted Reproductive Technologies for nearly a decade. Wow, Doc.
Yeah.
That's a
Doesn't-
long time.
Yeah. Well, I'm an old man now.
No, I mean, it really says that you're a very experienced doctor.
Yes.
Yes. But one thing I noticed in your clinic, you're you're so open-minded in all this natural medicine, and also you have sometimes like a psychologist, and then so you are really support your patients, not only what you have and then other method what they need for this journey, correct?
Absolutely correct. Absolutely. There are many other things that are involved other than just the medicine aspect of this. There's no question that we do have a clinical psychologist who works with us because the emotional aspect of this is very important. We also try and work with groups like yours who provide acupuncture help for us. For a couple of different reasons. One, there's no question that when they undergo acupuncture, there's good evidence that it helps them to relax, which is good for the procedure. And then also when they undergo the process, I know that you believe that you can divert the blood flow to the vital organs. So theoretically, if you could divert the blood flow to the ovary, you could get better delivery of oxygen, better delivery of nutrition, better delivery of the hormone to the developing egg, get a better quality egg. And similarly, if you could do that with respect to the uterine lining, you get a better quality uterine lining for implantation. So there's no question that there's good literature in our literature that shows that acupuncture has been very beneficial.
Thank you so much for your support. I truly appreciate it. So tell me a little about your practice, Doc.
So typically we are an all-inclusive infertility practice. So we do monitoring of ovarian function. We do procedures like insemination. We do IVF. We do the pre-implantation genetic testing for embryos. We also do fertility preservation, which is where we will freeze eggs for women. And we've been doing that for many years. And in fact, the original group of patients that we did fertility preservation for were women who had life-threatening diseases or were faced with losing their pelvic organs. But now it's expanded to women, for example, who are getting older but don't have a partner, they're on a trajectory to obtain their professional status, and they don't really have a chance to really do a family. So since the most critical factor that plays a role with respect to fertility is the age of the egg, the younger that we can preserve those eggs, the better that we are. And then ultimately, we are a full service organization with respect to all aspects of infertility care.
That's more convenient for patients, and
Absolutely.
appreciate it. Make this available for our patients, and especially in this Orange County. So I'm curious, what got you into this reproductive field? Is there any story?
Well, I always wanted to deal with hormones. Hormones are one of the few things that actually make sense in medicine. If you have too much of a hormone, you react in a certain way. If you have too little of a hormone, you react in another way. But combining it with reproductive medicine allows me to deal with young, healthy patients who, when we are successful in what we're trying to achieve, that is to help them have a family, it's by far the most exciting event that can occur for those people. And when we're not successful, which occurs as well, fortunately, you're not telling somebody that they have cancer and that they're going to die. These are people who will emotionally recover, they'll come back, they'll function, and their lives will go on. So for me, it's just the most perfect form of medicine that there could be. Plus, I get to deal with basically healthy, active, young patients.
That's true. That I notice whenever I do more infertility, you see more younger generation. And that's probably, we are in all this field because that's most important value I think that you can create for the patient is a family. And
That's
then
exactly right.
yeah, lovely. So I know you're already using acupuncture to improve your chance of, let's say, lining and then like egg quality. But do you have any recommendation for people to especially improve their egg quality, like a supplement or exercise or anything?
Well, there are various supplements that are available in the outside, things like CoQ10, things like DHEA. Those are all substances that patients will certainly see on the internet and see that other patients use those. The data as to whether or not they're really as beneficial is not nearly as clear as the data that shows that acupuncture is a beneficial thing.
And then also safety issue as well, I guess.
Correct.
Because of
Absolutely.
the outside, the hormones sometimes is tricky. So one thing quick, I had one patient came and she really had a challenge with the egg quality, and somehow she started taking this diabetes medication. She was not a PCOS though. So the regulate her blood sugar level suddenly improved her egg quality so much. So we are talking about more lifestyle, like we do a lot of a fertility diet and the low carb and so and so and good fat. But do you see regulating your blood sugar level for those like a pre-diabetic patient, have a maybe better chance of a good egg quality?
Yeah, I think there's no question that in those patients who are either diabetic or pre-diabetic, being able to control their blood sugar is a very important factor just with respect to their general health. And if you can control their general health, then you're improving their likelihood of getting better quality eggs.
That's a good for, as I said, that's benefit for everything. The
Absolutely.
blood sugar management, I think that's probably more than half of our patients are going through. Even they are very fit, looks like very fit, but I'm always seeing some little challenge with their sleep and then their eating and stress. Definitely create some problem with the blood sugar management as well. So you already explained about you use acupuncture for the ART program. And can you share, doctor, how patient can find you? I know you had a seminar before, but during this COVID, I don't know how patient can find you.
We still have a seminar. We have a monthly seminar. It's usually the second Wednesday of every month. And you can go online at coastalfertility.com and you can see the list. So once a month, we have a general seminar. Right now, it is online because of COVID, but it used to be that patients could come and see the facility as well. But now it's online. And then once every quarter, we also have a seminar with respect to fertility preservation. So those are all online as well.
Excellent. So just check the Coastal Fertility and then they can find the information further.
Absolutely.
So thank you again for being with us and available for this interview. And before I let you go, since you are so experienced, doctor, you are so experienced. Is there anything you have something what they can do at this time to improve their chance of getting pregnant, like except the ART? Okay, do you have any like a diet or sleep or? Because in our clinic we have something called like a 3. I always ask them to do breathing properly, like a longer breathing, like sort of a meditation, but also dehydration. I'm noticing a lot of our patients. And their sleeping is really problematic as well for this working generation. Do you have anything they can improve on? At least something you see like a.
Well, I think exactly what you just said, Dr. Lee. Part of the reason that we do refer our patients to the acupuncturist is, of course, for the benefit that we think it does to the development of the egg and the development of the lining. Those are all things that we agree with. But it is also because you offer those special benefits to those patients, like diet, like encouraging them how to diet, what types of foods are good for them, and the idea that the sleep is necessary for just building your body and being healthful. So absolutely, we try and encourage that as well.
Thank you so much for your time, Doc.
Thank you.
Always good to see you. Thank you.
Good luck, and thank you again, Dr. Lee.
Thank you.
Bye-bye.